Hi, my name is Arlene Lamas, and I work for the College of Nursing and Health Innovation, and I'm here to talk to you about stress management. Tips to help manage stress. Stay connected and get social support. Call a friend, send an email, or visit any of our counseling services locations. Sharing your concerns or feelings with another person helps relieve stress, but it's important that the person whom you talk to is someone whom you trust and whom you feel can understand and validate you. If your family is a stressor, for example, it may not alleviate your stress if you share your work's woes with one of them. Just know that you are not alone. ASU counseling services are a resource for you. More information about counseling services will be provided shortly. Confront stressors and create a plan. Take back some control by directly confronting stressors and creating a plan. Write down your situation as well as specific solutions within your control for addressing these stressors. Confronting stress can cause a temporary increase in stress, but getting a plan down on paper will reduce stress in the long run for most people. A plan can include gathering more information about options and asking for help. Once a plan has been developed, commit to it and review it regularly. Identify and change unhealthy coping strategies. Stress can lead us to start doing things we know are not healthy, such as eating poorly or using alcohol or other drugs. It can also lead us to stop doing things we know are healthy, such as exercising or going to bed on time. While it can be tempting in the short run to rationalize such behavior, the result is usually an increase in our stress rather than a decrease. Exercise benefits your mind just as well as your body. We keep hearing about the long-term benefits of a regular exercise routine, but even a 20-minute walk, run, swim, or dance session in the midst of a stressful time can give an immediate effect that can last for several hours. How to talk to your loved ones about degree options. Before you get worked up about telling your parents, start off by making a list of all the reasons why you wanted to change your major. If becoming a healthcare coordinator suits your interests more than a nurse, be able to articulate some facts and concrete reasons why this is the career for you. Telling your parents you've chosen your new career path because it's what I want to be won't convince them. Make a list of the reasons of why your old major is not for you. If you're afraid to tell your parents for financial reasons, map out a budget and the cost of you switching your major. This list should include tuition for an extra year, graduate expenses, living expenses, and also add in the starting salary for the jobs within your new major. Don't forget that ASU has many financial aid options. Almost everyone, regardless of income, can qualify for some form of financial aid. In fact, more than 70% of all ASU students receive some form of financial assistance every year. Don't let financial reasons keep you from majoring in what you're passionate about. Explain why you are so passionate about this new major and what you want to do with it now and in the future. There's a possibility that your loved ones may be upset in the beginning, but just remember this is your choice to make. This is what you're going to be doing for the rest of your life. Do what ultimately will make you happy, what will get you to where you want to be at the end of your college career. You may be worried now, but remember that your loved ones sent you off to college to chase after your dreams. Stay strong and most of all, stay focused. You went to college to get an education in something you want to pursue for the rest of your life. Don't take it lightly, work hard, persevere, and aspire higher than you ever have before. Good luck to you if you're telling your parents tonight, tomorrow, next week, or next month. Congratulations on your new major. Community Health. The BS degree program in Community Health is designed for students who want to create healthy, sustainable communities with an emphasis on working with specific populations. Community health professionals work in partnership with private and public organizations to address health needs of diverse populations by providing advocacy, capacity building, service coordination, education, monitoring, evaluation, and interventions within a community setting. This degree uses the same prerequisites as pre-nursing and the nursing major. Therefore, students who become off track may seamlessly transition to this major and obtain a Bachelor of Science degree in a health-related field. Changes to the healthcare system call for an increased need for community health professionals who can advocate for patients, families, and communities, as well as provide health education services. It is anticipated that the demand for community health professionals will increase with the continued implementation of the Affordable Care Act. Graduates of this program will provide healthcare education, health promotion, care coordination, disease management, healthcare navigation, and advocacy services for patients, families, and communities. Program graduates may obtain employment as community health workers. Roles include, but are not limited to, creating connections between vulnerable populations and healthcare systems, determining eligibility and enrolling individuals in health insurance plans, ensuring cultural competence among healthcare professionals serving vulnerable populations, healthcare navigators, Roles include, but are not limited to, help consumers, small businesses, and their employees as they look for health coverage options through the marketplace, including eligibility and enrollment forms. Coordinate various aspects of health care and wellness so patients can focus solely on regaining health. Health Services Administrators. Roles include, but are not limited to, ensuring healthcare services are delivered quickly and at the utmost quality, ensuring that a healthcare facility or department is compliant in all areas of relevant healthcare law. Healthcare Compliance and Regulations. The BS programs in Healthcare Compliance and Regulations prepare students for careers as certified healthcare compliance professionals who will work in hospitals, medical centers, physician offices, and other health-focused agencies to ensure compliance with federal, state, local, and organizational rules, policies, and best practices. Program graduates may obtain employment as compliance analysis. Ensure that activities of their employing companies adhere to guidelines established by the government or nonprofit agencies that regulate them. Healthcare Regulatory Affairs Specialist. Help promote the safety and effectiveness of drugs and policies that improve and save lives. HIPAA Compliance Specialist. Reviews HIPAA authorizations to ensure compliance with company requirements. Healthcare Coordination. The BS program in Healthcare Coordination prepares students to effectively coordinate resources to optimize individual health outcomes. It integrates professional best practices from the business, regulatory, ethics, engineering, and medical industries to prepare students for careers as certified healthcare compliance professionals in a variety of health-focused agencies. Students will build a thorough understanding of healthcare systems, community and public health, community resources, health education, and health advocacy. Program graduates may obtain employment as community health workers, create connections between vulnerable populations and healthcare systems, determine eligibility and enrolling individuals into health insurance plans. Health advocates assist the clients or patient navigate the healthcare system to address any healthcare needs. Health educators teach people about behaviors that promote wellness, develop and implement strategies to improve the health of individuals and communities. Health Innovation. The BS program in Health Innovation provides students with a broad background in the principles of innovation, leadership, complexity science, change theory, collaboration, and evidence-based decision-making to prepare graduates to manage implementation of innovation in the healthcare arena. This unique program situates students at the intersection of innovation and entrepreneurship in health and healing. Program graduates may obtain employment as healthcare administrators, manage, direct, and coordinate medical services in a variety of settings from clinics, hospitals, to practices operated by groups of physicians. Minimize costs and maximize efficiencies while ensuring that services provided are the best possible. Healthcare managers, responsible for ensuring that the day-to-day operations of their healthcare facilities run smoothly and efficiently. Stay up to date on the latest healthcare policies and regulations to ensure facilities are compliant with state and federal laws. Health service managers, plan, direct, or coordinate health services in hospitals, clinics, managed care organizations, public health agencies, or similar organizations. Integrative health. The BS in Integrative Health provides a foundation in integrative health, a holistic approach to wellness that focuses on the mind, body, and spirit. The program provides students with the foundation of innovative and interprofessional approaches to serving and supporting diverse populations. Students will learn to differentiate the ethics, legalities, and standards of practice of integrative health and to think critically about different therapies, modalities, and practitioners. Coursework and experiences include an emphasis on research and evidence-based practices and gaining an understanding of the historical and cultural foundations of the integrative health field. Program graduates may obtain employment as health educators, teach people about behaviors that promote wellness, develop and implement strategies to improve the health of individuals and communities. Patient representative for integrative health involves assisting patients in obtaining services and in understanding policies and in making healthcare decisions regarding the integrative health. Counseling services. ASU counseling services are for any Sun Devil regardless of your race, gender, sexual orientation, age, student status, religion, ability, size, financial situation, the issue you're dealing with, or whether or not you've had counseling before. Something as simple as talking to someone can help you feel better, improve your grades, and manage your stress. Visit https://eoss.asu.edu ASU.edu/counseling for more information. For after-hour and weekend services, call Impact's 24-hour ASU dedicated crisis hotline at 480-921-1006. For life-threatening emergencies, please call 911. Academic advising. CONHI academic advisors are available to answer questions regarding schedule plans, registration for classes, degree requirements, or any problems you may be experiencing in your academic progress. For more information, please email conhail_advising@asu.edu. Sun Devil Fitness Center. ASU Sun Devil Fitness enhances the ASU experience by providing programs, services, and facilities that promote healthy lifestyles, build community, and enable student success. Sun Devil Fitness offers a variety of recreation, fitness, and sport opportunities that include intramurals, group fitness, personal training, sports club, and instructional classes. All of these programs welcome new participation in each session.